Now let us know about anemia. What is anemia? So definition of anemia or meaning of anemia is decreased amount of hemoglobin and or RBC count, that is red blood corpuscles count, below normal level for age and sex of the subject, and irrespective of age and sex, reduction of RBC count below 4 million per cubic millimeter of blood or hemoglobin level of 12 gram percent is anemia. Below 12 gram percent is anemia. Anemia is qualitative and quantitative reduction. Anemia is qualitative and quantitative reduction of hemoglobin. What is the pathophysiological effect of anemia? RBC, due to presence of hemoglobin in them, carries oxygen from lungs to tissue. But when there is reduction in hemoglobin amount or reduction in RBC count, then oxygen carrying capacity is compromised and it is insufficient to meet the body's physiological needs of oxygen. What are the things necessary for RBC production or hemoglobin production? For hemoglobin production, first thing is protein, then iron, and for its maturation of RBC, folic acid, vitamin B12, zinc, and vitamin C, and some other trace elements are necessary for production of RBC or formation of RBC. Then what is the normal RBC? What is the normal? Other things, zinc, copper, etc. are in trace amount, therefore they are available in normal diet, and we are not much more concerned about all these things. But supplementation of zinc and vitamin C will aid to the formation of hemoglobin. The iron requirement is adult male is 0.3 milligram. In non-pregnant woman it is 0.6 milligram. Pregnant woman 1.9 milligram per 1000 calorie of diet energy in second trimester, and in third trimester it is increased to 2.7 milligram per 1000 calorie of dietary energy. Infants it is 1 milligram, adolescent girls 0.8 milligram, and adolescent boys it is 0.6 milligram. Why there is difference between demand of iron in adult male and non-pregnant adult female? This is due to loss of blood in menstruation in adult females. In pregnant woman there is demand in second trimester, which increases in third trimester. And for infants 1 milligram is essential because they are growing and they need much iron and hemoglobin. And this is the case of adolescent girls and adolescent boys also, there is difference. Then prevalence of anemia. It is widely present in whole world, but on WHO global database on anemia in 1993 to 2005 estimated the prevalence of anemia in as a whole it is 45%, and as a whole 25%, in which 9% in developed case and 43% in developing countries. In developed countries it is 9%, but in developing countries it is 43%. And in India, incidence of anemia is very high. In pregnant women, it is 58%, and about 50% in case of non-pregnant women, 56% in adolescent girls, 30%, 39% and 30% at adolescent boys and 58% in children. This is the data. And in all these cases, nutritional anemia is a major public health problem issue. Then, what is normal level of hemoglobin? As I mentioned, that level of hemoglobin varies with age and sex. Then normal value of hemoglobin depends on age and sex of the subject. Newborn, irrespective of age, it is 16 gram to 20 gram per 100 milliliter of blood. 16 to 20 gram per 100 milliliter of blood. In infants, it is 23 gram percent of blood or to 23 gram per deciliter of blood. Due to RBC, number is more. At the end of 3 months, it reduces and becomes 10.5 gram percent. This is due to destruction of RBC, and babies are milk fed, which is poor source of iron. At the end of 1 year, it is 12.5 gram percent. Adult male 14 to 18 gram percent and adult female 12 to 15.5 gram percent. Female after menopause, it becomes 14 to 80 gram percent of blood, average 15.5 gram per deciliter of blood, and that is equal to male level. Then, ये चीज़ यहाँ पर रहेगा ना. Now normal count of RBC. Normal count of RBC, it also depends upon age and sex of the individual. At birth, 6 to 7 million irrespective of age. At birth, it is 6 to 7 million per cubic millimeter both in male and female. And at first week of life, it reduces to 4 to 5 million per cubic millimeter of blood, irrespective of sex. In both in male and adult male, 5 to 6 million per cubic millimeter of blood, average 5.5, and adult female 4 to 5 million per cubic millimeter of blood, average 4.5 million per cubic millimeter of blood. In old age, male and after menopause female, it is 4 to 5 million per cubic millimeter blood. Its value is same for both male and female. Menopause prevents blood loss in female, and male decreased amount of testosterone. In old age reduces stimulation of erythropoiesis. Severity of gradation of severity: mild, moderate, and severe. Then mild anemia is hemoglobin level between 8 to 12 gram percent. Moderate anemia, hemoglobin level between 5 to 8 gram, and severe anemia, that is hemoglobin level is less than 5 gram percent. Causes of anemia are dietary deficiency of iron, vitamin, protein, trace elements, etc. Chronic hemorrhage due to worm infestation and for hookworm or some disease. So classification of anemia. Anemia is divided or classified according to first morphological classification, which is also known as Wintrobe's classification. Morphological classification, as its name suggests, depending upon the size of the RBC, it is based on the size and hemoglobin content of RBC. It is morphological classification, which is also known as Wintrobe classification. Then normal size of RBC is 7.2 micron. When the size of RBC is normal, that is normocytic anemia. Then microcytic anemia, that is size is increased and more than normal, and microcytic anemia when size of RBC is less than normal. What is normal? 7.2 micron. Then classification depending upon the hemoglobin content of RBC. Normochromic, RBC content is normal. RBC contains normal amount of hemoglobin. Hypochromic, RBC contains less amount of hemoglobin, and hyperchromic is not possible as RBC cannot contain more amount of hemoglobin. Etiological classification. Etiological classification is based on the cause of anemia. It is also known as Whitley classification, Whitby's classification. That etiological classification is based on the cause of anemia. It is also known as Whitby classification, in which dietary deficiency, iron and other trace elements, vitamin, protein, hormones, etc. are not less in amount. Hemorrhage due to blood loss may be acute, sudden loss of blood, cut injury, chronic slow loss of blood by worm infestation, hookworm or piles, peptic ulcer. Hemolytic intracapsular due to intracapsular defects, and for example, congenital, it may be congenital spherocytosis, hemoglobinopathy, sickle cell anemia, thalassemia major and minor, and extracorpuscular defect is acquired. This may be due to infection, malaria, or it may be due to drugs. And third is depressed hemopoiesis. Dietary deficiency may be due to absence of nutrients in the food, or it may be due to they are present in food but GIT is not capable to absorb it. Just for example, sprue or diarrhea, loose motion, chronic loose motion. In those cases, these are present in the food but system is not able to absorb it. Then groups of people at is increases to developing anemia. Group of people, premature infants and children who do not get enough iron from breast milk. Premature infants and children. Then children need more iron during growth spurt. Women, as they lose blood during menstruation, vegetarian, and persons with ulcers, that is chronic loss of blood. Then they are persons not taking well-balanced diet. They are much more at risk. Okay.